And I would like to start by acknowledging International Women's Day this Sunday. This is a moment to remember that around the world, many women cannot access essential health services and continue to suffer disproportionately from preventable and treatable diseases. But International Women's Day is an opportunity not only to promote and protect the health of women, but to highlight the vital role they play in promoting and protecting the health of all people. Globally, women make up 70% of the global health workforce, but hold only 25% of senior roles. WHO is committed to promoting gender equality everywhere, and especially in the health workforce. We're proud that we have achieved gender equality in our senior leadership team at WHO headquarters, although we know we still have to work to do in other parts of the organization. Women are also playing a vital role in the response to COVID-19, and we're proud to have many amazing women leading our response in WHO, including Maria, Sylvie, Somia, Anna Maria, Maria Angela, Mary Pierre, Adriana, Gabi, Nika, and many others. In the past 24 hours, 2,736 cases of COVID-19 were reported from 47 countries and territories. There is now a total of 98,023 reported cases of COVID-19 globally and 3,380 deaths. We are now on the verge of reaching 100,000 confirmed cases. As cases increase, we are continuing to recommend that all countries make containment their highest priority. We continue to call on countries to find, test, isolate, and care for every case and to trace every contact. Slowing down the epidemic saves lives and buys time for preparedness and for research and development. Every day we can slow the epidemic is another day hospitals can prepare themselves for cases. Every day we slow down the epidemic is another day governments can prepare their health workers to detect, test, treat, and care for patients. Every day we slow down the epidemic is another day closer to having vaccines and therapeutics, which can in turn prevent infections and save lives. As you know, last month WHO convened a meeting of more than 400 scientists to identify research priorities. Hundreds of ideas were discussed and debated, and today we're publishing an R&D roadmap which distills those ideas into a core group of priorities in 9 key areas. These include the natural history of the virus, epidemiology, vaccines, diagnostics, therapeutics, clinical management, ethical considerations, social sciences, and more. The R&D roadmap focuses on research that can save lives now, as well as longer-term research priorities for vaccines and therapeutics. It's vital to coordinate research so that different groups around the world complement each other, so WHO can give better advice and countries can take evidence-based decisions that save lives. That's why WHO has developed a set of core protocols that outline standards of how studies should be done and to collect critical data so we can compare apples with apples and pull data from multiple studies. France and South Africa have already indicated they will use these protocols for clinical trials, and we encourage other countries to do the same. We are also developing research protocols to assess interventions for disenfranchised communities such as refugees and internally displaced persons. We're very encouraged by the level of interest around the world in accelerating research as part of the response. So far, WHO has received applications for review and approval of 40 diagnostic tests, 20 vaccines are in development, and many clinical trials of therapeutics are underway. Even as we test therapeutics, we need to ensure that supplies of those medicines are available should they prove effective. WHO has been monitoring the potential risk of a disruption to medicine supplies as a result of the COVID-19 epidemic. China, as you know, is a major producer of active pharmaceutical ingredients and the intermediate products that are used to produce medicines in other countries. WHO has focused on the most essential medicines that are critical for primary health care and emergencies, including antibiotics, painkillers, and treatments for diabetes, hypertension, HIV, tuberculosis, and malaria. WHO is working closely with industry associations, regulators, and other partners to monitor this risk. And so far, we have not identified any imminent specific shortages. Many manufacturers either have alternative sources of ingredients or had stocks to draw on. Manufacturing has now resumed in most places in China, although some challenges remain. Separately, WHO has developed a list of more than 20 essential medical devices that countries need to manage patients, including ventilators and oxygen supply systems. Access to medical oxygen could be the difference between life and death for some patients, but there is already a shortage in many countries which could be exacerbated by this epidemic. WHO has an existing working group with the Gates Foundation, the Clinton Health Access Initiative, and PATH, and we're building on that partnership to increase access to oxygen. We encourage every country to review WHO's disease commodity package for COVID-19 to ensure it has the supplies it needs, including protective equipment and medical devices. All of this requires the involvement of the private sector to ensure countries can access life-saving products. You have heard me talk about the market failure for personal protective equipment. You heard me talk about the need for a whole-of-government approach. And you have heard me talk about what individuals can do to protect themselves and others. We look forward to businesses to step up and play their part. We need you. WHO is working with the World Economic Forum to engage companies around the world. And earlier this week, I spoke to more than 200 CEOs about how they can protect their staff and customers, ensure business continuity, and contribute to the response. As I keep saying, we are all in this together, and we all have a role to play. Facts, not fear. Reasons, not rumors. Solidarity, not stigma. I thank you.